Sponsored by rxcardclub.com. Get a free prescription drug card and save up to 85% on prescription drugs. rxcardclub.com, interpreting sodium blood test results. A sodium, Na+, blood test is a standard medical test that checks sodium concentration in your blood. This test is important because having too high or too low a sodium concentration in your blood can cause serious medical problems. Various medical issues can affect your sodium blood levels. /r/n/r/n. However, this test typically does not provide good information about whether you should reduce the amount of sodium in your diet. /r/n/r/n. This article discusses what sodium blood tests do and do not indicate, why you might have abnormal results, and how a healthcare provider may address abnormal results. /r/n/r/n. Pelfini, La Waziya Photography, Getty Images /r/n/r/n. A sodium blood test measures the sodium concentration in your blood. Sodium blood test ranges can be normal, low, or high and are measured in milliequivalents per liter, mEqL, as shown below. /r/n/r/n. Your body usually does a good job regulating the amount of sodium in your blood. When levels are off, however, body systems such as your brain and heart can be affected. /r/n/r/n. A normal sodium concentration in the blood is between 135 and 145 mEqL, and if sodium concentration in your body gets too high or too low, your body usually adapts. For example, your kidneys may react by retaining more sodium, releasing more water in your urine, and increasing your thirst. /r/n/r/n. If your sodium levels are less than 135 mEqL, a healthcare provider may tell you that you have hyponatremia, a lower than normal sodium concentration in the blood. Severe hyponatremia, which poses an increased risk of serious complications, is defined as 120 mEqL or less. /r/n/r/n. Low sodium concentration in the blood is a common medical issue, particularly in older individuals or people who are ill from various medical problems, such as kidney, heart, or liver disease. Certain medications can also cause hyponatremia, including /r/n/r/n. Hyponatremia can happen when the amount of water you are taking in is greater than the amount you are losing, for example, through your urine, and your body can't sufficiently adapt. It can also happen when you are losing a lot of sodium from your body. /r/n/r/n. Hyponatremia is a sodium concentration that is too high in the blood, greater than 145 mEqL. It doesn't happen as often as hyponatremia, but it is more common in infants, older adults, or anyone without normal thirst mechanisms or lack of access to water. /r/n/r/n. Hyponatremia can occur when the body loses a lot of water, like through dehydration. It might also occur with excess vomiting, sweating, or urination. /r/n/r/n. Certain drugs can also cause it, including /r/n/r/n. Less commonly, it can result from extreme sodium intake, like through an intravenous line in someone in an intensive care unit. It's very uncommon for a person to have hyponatremia just from their dietary intake of sodium unless they also have a medical problem like kidney disease. /r/n/r/n. People with hyponatremia or hypernatremia may be dehydrated, have normal hydration, or are overhydrated. A sodium blood test does not determine the amount of water in the body. Healthcare providers use a medical history, exams, and other tests to determine this, which influences their treatment approach. /r/n/r/n. Sodium levels that are too high or too low can have significant health impacts, particularly when they're extreme or if the change happens suddenly. /r/n/r/n. Having hyponatremia may not cause any symptoms, especially at first. But if it worsens or isn't corrected, it may cause issues like headache, lethargy, or dizziness. When severe, it may be more likely to cause serious issues, such as /r/n/r/n if present. Symptoms of hyponatremia tend to be mild in adults. They might include lack of appetite, vomiting, muscle weakness, and restlessness. However, more severe symptoms, like seizures or coma, are a greater risk in infants or people with very high sodium levels. /r/n/r/n A sodium blood test is a common test. You might get it as part of a general checkup or if you are being treated at the emergency room or hospital. Other reasons to have a sodium blood test include /r/n/r/n A sodium blood test tells you that the sodium concentration in your blood is high, but it doesn't explain why. For that, you may need additional tests. /r/n/r/n A sodium blood test isn't a good way to check whether you are getting the right amount of sodium in your diet. That's because the body is usually very good at adapting and keeping the sodium concentration in your blood at normal range. /r/n/r/n Even if your sodium blood test is normal, you might still get too much salt through your diet, leading to issues like high blood pressure. A better way to check your salt intake is to use a food diary and discuss your results with a healthcare provider. /r/n/r/n Many people need to reduce sodium intake in their diet. The following are some ways to decrease dietary sodium potentially: /r/n/r/n If your sodium blood test is too high or too low, you may need treatment to restore your sodium to normal. However, the treatment approach may vary depending on whether you have hyponatremia or hypernatremia, its severity and rapidity, whether you are also dehydrated or excessively hydrated, and the underlying cause. /r/n/r/n Sometimes, a healthcare provider might monitor a low blood sodium level, but you may need treatment in other cases. Some possible treatments might include /r/n/r/n In certain circumstances, a person might need to increase their daily salt intake, but this is often not the case, and for some, it would be detrimental. Check with a healthcare provider to see if you need to increase the amount of salt in your diet. /r/n/r/n Some people with high blood sodium also need treatment. Some examples include /r/n/r/n Many people with hyponatremia may also need to limit their salt intake in the long term, but not necessarily everyone. Talk to a healthcare provider about the next steps. /r/n/r/n A sodium blood test is a common assessment that measures your blood's sodium concentration. It can be affected by the amount of sodium and fluid in your body. Typically, the kidneys tightly regulate the blood sodium concentration. But sometimes, it can become too low, hyponatremia, or too high, hypernatremia. Both can cause serious health consequences, like seizures. /r/n/r/n Healthcare providers often perform sodium blood tests as part of a general medical evaluation for outpatients or hospitalized people, usually along with other related tests. However, the test is not a good way to monitor your salt intake, which may need lowering in people with high blood pressure, kidney disease, or certain other health conditions. /r/n/r/n rxcardclub.com. Get a free prescription drug card and save up to 80% on prescription drugs.